Fully assembled, the AeroPro handpiece is compliant with the current Centers for Disease Control and Prevention reprocessing guidelines for dental handpieces. The AeroPro components are classified into 3 categories for infection prevention: disinfected, steam autoclave sterilized, and disposable. The motor component, which houses the battery, motor, and circuit board, is disinfected. The outer sheath that protects the motor component is steam autoclaved. Both the disposable Prophy angle and custom polyethylene barrier are single-use items and are discarded after each treatment. The charging station with AC adapter are disinfected, and the included tray stand is steam autoclaved. The motor component, charging station, and AC adapter cannot be steam autoclaved and need to be disinfected. Step 1. Cleaning the components. Ensure that soiled gloves are removed and replaced prior to the cleaning and disinfecting process. Using a water-based CDC intermediate level of disinfectant wipe or equivalent, wipe charging station, motor component, and AC adapter. Discard used wipe. Dry components with a clean, soft cloth. Step 2. Disinfecting the components. Using a new disinfectant wipe, wipe motor component, charging station, and AC adapter. Allow disinfectant to air dry and discard used wipe. If choosing to use a spray delivery disinfectant, spray disinfectant solution onto a clean cloth. Wipe the charging station, motor component, and AC adapter. Never spray solution directly onto the AeroPro components. After appropriate dwell time, dry components with a second clean cloth. The outer sheath and tray stand must be steam autoclaved between patients. Clean the components prior to placing into the autoclave. Using a lint-free cloth, dampened with a prepared enzymatic detergent, thoroughly wipe the outer sheath and tray stand. If needed, clean the components until all visible debris is removed, paying attention to the outer sheath nose cone area. Rinse the components under running tap water for 30 seconds to remove detergent residue. Dry all the components using a second clean, lint-free cloth. Place each item into a separate steam sterilizing pouch. If using a sterilizing cassette, ensure the sterilizer's maximum load is not exceeded. Place into a steam autoclave and follow the autoclave manufacturer's instructions. Cold liquid disinfection sterilization, chemical vapor sterilization, and dry heat sterilization methods have not been tested or validated for efficacy and are not recommended. Following these simple directions keeps you compliant with the current infection control guidelines and minimizes your patient's risk of cross-contamination.